Celebrating service in Nye County for 10 years, Desert View Hospital.
We now know that heart health really begins in childhood. When people aged 50, 60, 70 have a heart attack due to plaque buildup, that didn't just happen overnight. We know that this process starts really in the teenage years, and we know from studies on young men in their 20s, mid-20s, late 20s, that if you look at their arteries, they've already got buildup. So this starts early. So the preventive piece obviously has to start early.
Is buildup the main cause of heart attacks?
By far, in a way. Almost every heart attack. Now, again, medically, when we talk heart attack, we physicians are talking about a buildup that leads to a blockage, that leads to the attack, which is damage to the heart muscle. In lay terms, of course, heart attack could mean any number of things. I fainted, or gee, my blood pressure went up really high, or had a chest pain, or my heart rhythm went off. A lot of people might think, well, that's a heart attack. But when we use that word, we're talking about the number one problem, which is the artery blocking, causing the damage. That's what we call a heart attack.
What causes your artery to block?
Well, it's a complex process. I mean, one of the things I encounter is people thinking, well, if I do X, then Y is going to happen. But it's not what I call a one-to-one or linear process. It's what we call in medicine polygenic or multifactorial. So, as an example, I could take two people who seem identical. One of them smokes heavily, eats a fatty diet, and is maybe 40 pounds overweight and has diabetes. That person may have normal arteries, whereas I could have a lean person who bicycles and is normal body weight and doesn't smoke, and they may have a heart attack with clogged arteries. So that's the extreme example, but it proves the point that there are differences from one person to another.
How can a person prevent a heart attack?
Well, okay, so we have very good information about that. We know what a person has to do to decrease their risk. Prevent, there's nothing you can do that will guarantee or immunize you from having one, but it's all about risk. And how do you decrease your risk? And we know this very clearly